Hey everyone, welcome back to Daniel Learn English, your home for real English conversations. I'm Sofia.
And I'm Daniel. And today's episode is super important. We're practicing English for visiting the doctor. Useful, natural, and real-life English.
Yes, this is not textbook English. These are sentences real patients use in American clinics and hospitals.
And we'll practice step by step. How to check in, how to explain symptoms, how to answer medical questions, how to ask for treatment, and how to understand the doctor clearly.
Plus, we'll give you easy phrases that anyone can use, even beginners.
Today, I'm the patient. I'm not feeling well.
And I'm the medical student at the clinic helping you talk to the doctor.
Let's start with what happens first. Checking in at the front desk.
Good morning. How can I help you today?
Hi, I'd like to see a doctor, please.
Sure. Do you have an appointment?
No, but I'm not feeling well.
Okay, no problem. I can help with that. Can I have your name, please?
Yes, my name is Daniel.
Thank you, Daniel. What seems to be the problem today?
I've been having headaches and fever since last night.
I see. How long have you been feeling this way?
About 12 hours.
Let's learn some useful check-in phrases. 1. I'd like to see a doctor. Very polite and common. 2. I'm not feeling well. Simple and hopeful. 3. I've been having symptom since time. Example, I've been having stomach pain since yesterday. 4. I don't have an appointment. For walk-ins.
You can pause the video and practice these sentences after us.
All right, Daniel, can you please fill out this form?
Sure, what do I need to write?
Just your basic information. Name, date of birth, phone number, emergency contact, your symptoms, any medications you're taking.
Okay, reason for visit. Should I write headache and fever?
Exactly. Keep it short and simple. Let's learn some clinic words. Word phrase. Check in. Register at the clinic. Symptoms. What is wrong with your body? Fever. High body temperature. Headache. Pain in the head. Medical history. Your past health problems. Allergies. Things that make your body react.
These words are very common in medical English, so memorize them.
I'm sitting in the waiting room now. Clinics always make me nervous.
It's normal. Everyone feels that way at the doctor.
Do Americans talk in waiting rooms?
Sometimes, usually politely, like, is the wait long today? Are you here for a checkup? I hope you feel better soon.
Oh, that's nice.
I'm feeling sick. I'm feeling weak. I'm not doing great. I think I need a doctor.
All are simple and natural.
Daniel? Daniel?
Yes, that's me.
Great. Come with me, please. We're going to check your vitals.
Vitals?
Yes. Vitals means blood pressure, temperature, heart rate, and oxygen level.
Oh, okay.
Let's explain. Blood pressure, how strong the blood pushes in your veins. Temperature, if you have a fever. Heart rate, how fast your heart beats. Oxygen level, how much oxygen is in your blood.
Now I understand everything.
Okay, Daniel, I'm going to take your temperature. Please open your mouth.
Okay.
Your temperature is 101 degrees Fahrenheit. That means you have a fever.
Oh no.
Now I'll check your blood pressure. Please relax your arm.
Is it okay?
Yes, your blood pressure is a little high, probably because you're sick.
Makes sense.
Doctors and nurses may ask, how long have you felt this way? Where does it hurt? Are you allergic to any medication? Have you taken anything for the pain? Do you have a chronic condition?
Very useful.
Before the doctor comes in, let's practice explaining symptoms.
Sure.
Try to answer, what brings you in today?
Okay. I have a headache and a fever. My body feels weak and tired.
Perfect. Clear and simple.
I've been having chest pain. I've been having stomach cramps. My blank feels blank. My throat feels dry. My back feels stiff. It hurts when I blank. It hurts when I breathe. It hurts when I swallow. These templates are gold.
Hi, Daniel. I'm Dr. Sofia. I hear you're not feeling well today.
Hi, doctor. Yes, I've had a headache and fever since last night.
I see. Let me ask you a few questions.
Welcome back. This is part 2 of our real medical English conversation. Daniel and I are already inside the clinic, and now it's time to begin the checkup. Listen carefully, repeat after us, and learn the exact English you need when you visit the doctor. Ready? Let's continue.
Good morning. Are you Daniel?
Yes, that's me.
Great. Hi, Daniel. I'm Dr. Rivera. Nice to meet you.
Nice to meet you too, doctor.
So, what brings you in today?
The doctor asked, "What brings you in today?" This means, "Why are you here?" You can answer with, "I'm here because," or "I came in today because."
Well, doctor, I've been feeling a little sick for the past 2 days. I have a headache, I feel tired, and my throat is sore.
I see. Have you had a fever?
I think so, yes. Yesterday, my body felt really hot.
Okay, and do you have a cough?
Just a small one, mostly in the morning.
Any trouble breathing?
No, breathing is fine.
Here are key useful phrases. I've been feeling sick. You are sick for some time. I have a sore throat. Your throat hurts. I had a fever. Your body temperature was high. Repeat after me. I've been feeling sick. My throat is sore. I had a fever. Good.
All right, Daniel, I'm going to ask a few more questions.
Okay. Do you have any allergies?
No.
I don't have any allergies. Are you taking any medications right now?
Nope, I'm not taking anything.
Have you eaten today?
Yes, I had a light breakfast. Good. And how is your sleep? Have you been sleeping well? Not really. My throat pain wakes me up at night.
I understand.
Doctors always ask these questions. Remember these useful patterns. I don't have any allergies. I'm not taking any medication right now. I haven't been sleeping well. Practice them with us later.
All right, Daniel. Let's start with your basic checkup. First, I'll check your temperature. Your temperature is a little high, 99.9 degrees Fahrenheit. Now, please breathe in deeply and breathe out. Again, breathe in and out. Okay, good. Your breathing sounds normal. Let me also check your throat. Please open your mouth and say ah. Ah. Your throat is red and a little swollen.
When doctors examine you, they often say, breathe in, breathe out. Open your mouth. Say, ah. Your throat is swollen, means it is bigger than normal. Repeat the phrases with me. Breathe in, breathe out. My throat is swollen. Great job!
Daniel, it looks like you might have a mild throat infection. Nothing serious, but you do need rest and medicine.
Okay, I understand.
I'll prescribe something for the pain and something to reduce the fever. You should also drink warm water and avoid cold drinks.
Thank you, doctor.
The doctor said, you might have a mild infection. Mild means not serious. I'll prescribe something. Prescribe means give medicine. Avoid cold drinks. Avoid means do not have.
Do you have any questions, Daniel? Yes, doctor. How long will it take to get better? Usually 2 to 3 days, but if your fever gets worse, come back. Okay, I will. Also, take your medicine twice a day, once in the morning and once at night. Got it. And drink plenty of fluids. Plenty of fluids, meaning water, soup, tea? Exactly.
Here are very important lines to remember. How long will it take to get better? Take the medicine twice a day. Drink plenty of fluids. These appear in real clinics every day. Great work! You completed part 2, the full checkup conversation. Next, in part 3, Daniel and I will go to the pharmacy, learn prescription English, and practice how to speak with a pharmacist. Get ready, it's super practical and very useful. All right, Daniel and Sofia, thank you for waiting. I have your test results here. Nothing serious, just a mild throat infection and dehydration. That explains your fever, sore throat, and weakness. That's a relief. So it's not dangerous? Not at all, but you do need rest and proper care.
Quick English phrase. Not at all. It means, no, don't worry, or not a problem.
Daniel, I'm prescribing 2 things. An antibiotic, take it twice a day after meals. Pain relief medicine, only if the fever gets high or the throat pain increases. Doctor, how long should Daniel take the antibiotics? For 5 days, and make sure you complete the full course, even if you start feeling better earlier.
What does complete the course mean?
It means take all the medicine for the number of days prescribed. Do not stop early.
Daniel to viewers. Great phrase for medical English. Complete the full course. Use this whenever you talk about finishing all the medication your doctor gives you.
Doctor, can I ask a few questions? Asking questions is important, even in real life. Of course, go ahead. Are there any foods he should avoid?
Yes, avoid cold drinks, ice cream, spicy food, and oily food for the next 3 days.
Is this infection contagious?
A little. So Daniel should avoid close contact and sharing cups, bottles, or utensils for 2 days.
Got it. No drinking from Sofia's coffee cup.
Hey, I wasn't offering it.
Can Daniel work or attend classes?
You can, but take it easy. No heavy physical activity, and make sure you drink plenty of water.
So I can work slowly.
Exactly.
Here are a few things you must do at home. Drink warm water every 2 hours. Gargle with salt water twice a day. Sleep 7 to 8 hours minimum. Avoid shouting or talking too much. Eat light, warm foods like soup and porridge.
Shadow with me. Drink plenty of warm water. Get enough rest. Avoid cold drinks. Repeat them. These phrases are extremely common in doctor conversations.
Doctor, when should Daniel come back?
If the fever continues after 48 hours, or if the pain gets worse. Otherwise, no need to return.
Daniel to viewers. Useful phrase. Come back for a follow-up. Meaning, return to the doctor to check your progress.
All right, Daniel, you're going to be fine. I'll send the prescription to the pharmacy. Thank you, doctor.
Yes, thank you so much.
Take care and get well soon.
Daniel, that was so helpful. I feel much better knowing it's not serious.
And now our viewers learned real medical English.
Yes, phrases like, I have a sore throat, I feel weak, can I get an appointment, what should I avoid, how long should I take this?
You can use these in hospitals, clinics, emergencies, or even for helping a sick friend. Repeat after me. I'd like to see a doctor. I have a fever and sore throat. What medicine should I take? Do I need a follow-up appointment? Great job! Repetition builds confidence.
Thank you for watching this full doctor visit conversation.
If you want Part 4, Pharmacy English and How to Pick Up Medicine, tell us in the comments.
And don't forget to like, subscribe, and practice daily English with us. See you next time.